The heart is an amazing organ. It keeps us alive by its fascinating work. But in order for it to help us, we also need to play our part in it. Keeping track of our heart's health is an important task because not everyone is lucky when it comes to heart diseases. Heart disease is a term covering any disorder of the heart which is a leading cause of death in many places, especially the United States. There are many types of heart diseases and all of them have different causes, symptoms and treatment. Hence, it is important to learn about these in order to live a better and healthier life. Most people think heart disease as one condition, but in fact, heart disease is a group of conditions with many different root causes. So for this reason, we are giving you the 10 most common heart diseases. Number 1. Pulmonary stenosis. This is a condition where it becomes hard for the heart to pump blood from the right ventricle into the pulmonary artery due to the tightness in the pulmonary valve. An infant with severe stenosis can turn blue. Older children will generally have no symptoms. Common symptoms include chest pain, breathlessness, and heart palpitations. In minor cases, medicines are enough to treat this condition, but in major cases, the valve will need to be fixed or replaced. Number 2. The mitral valve prolapse. This is a condition in which the two mitral valve flaps do not close smoothly. They bulge upwards or back into the atrium. In most cases, it is not life-threatening because they don't have no prominent symptoms and complications, but some cases may require treatment. In certain cases, there does not appear to be a slight increase in the risk of sudden death from this condition, but most diagnosed with MVP have an extremely mild form of the condition which carries no measurable risk. Number 3. Mitral regurgitation. Also known as mitral valve regurgitation, mitral insufficiency, or mitral incompetence, this condition arises due to mitral valve prolapse, where the blood flows back into the heart when it should leave because the mitral valve does not close tight enough. As a result, blood cannot flow through the body efficiently. When it is mild, this condition causes no problems, but severe regurgitations can lead to complications including heart failure. People with this often feel tired and out of breath. Number 4. Hypertrophic cardiomyopathy. This is a genetic disorder in which the wall of the left ventricle thickens. This results in the heart being unable to pump blood efficiently. A parent with HCM has a 50% chance of passing the disorder on to their children. In a small number of people with HCM, the thickened heart muscle can cause shortness of breath, chest pain, or problems in the heart's electrical system, threatening the lives of the patients. This condition is known to be the cause of sudden deaths in many athletes. Number 5. Heart failure. Also known as congestive heart failure, this is when the heart does not pump blood around the body efficiently to meet its needs. In some cases, this condition may also arise due to the inability of the heart to fill itself with enough blood. Most common symptoms are shortness of breath and fatigue. Thyroid disease or high blood pressure may lead to this condition. Narrowed arteries in the heart may also leave the heart stiff or too weak to pump. Treatment is given by a combination of certain medications depending upon the symptoms. Number 6. Myocardial infraction. Commonly known as a heart attack, the mortality rate of this condition has been estimated to be 30%. This condition is also known by names like cardiac infraction and coronary thrombosis. The main cause leading to this problem is due to the presence of a clot in one of the coronary arteries, depriving the heart of oxygen, which interrupts blood flow and in turn damages or destroys a part of the heart muscle. A number of medications can be used to treat a heart attack. Number 7. Coronary artery disease. Coronary arteries is responsible for the supply of nutrients and oxygen to the heart muscle. These arteries can be damaged due to the presence of excess cholesterol, which can narrow down these arteries and leave the heart unable to pump efficiently. This condition causes pain in the chest due to the hardening or the blockage of the arteries with the cholesterol build-up or plaque. Mild cases can be cured by medicines, but severe cases of this condition require surgery. Number 8. Dilated cardiomyopathy. This condition arises due to the weakening of the heart, causing a decrease in the ability to pump blood. It also contributes to irregular heartbeats and usually arises in the left ventricle, in which it enlarges and disrupts the normal pumping of the blood. Dilated cardiomyopathy might not cause problems, but some of it can be life-threatening. Treatment hinges on a few factors like the severity of your symptoms and complications as well as your age and overall health. Number 9. Arrhythmia. Normal heartbeat rate is between 60 to 100 beats per minute, but when your heart beats less than 60 or more than 100 beats per minute, then you're suffering from arrhythmia. This condition occurs when the electrical impulses in the heart that coordinates the heartbeat does not work properly, causing the heart to beat in a way it should not, either too slow or too fast, or even too erratically. Arrhythmias often develop from other heart problems but may also happen on their own. Medication and cardioversion are commonly used to bring your heart rate to a normal rhythm. And number 10, the congenital heart disease. This is a term commonly used for deformities in the heart. It is present at birth and is the most common type of birth defect. These defects can involve the arteries, veins, or even the walls of the heart. There is no cure for this condition. Many people go through surgeries, but that just fixes the malformations and do not cure them. The most common CHD or congenital heart disease is the ventricular septal defect. And that's all on heart diseases. So stay strong, stay healthy, but most importantly, stay vigilant and never ignore the signs. Subscribe to our channel for other related content on diseases, microbial organisms, and much more.